Hi, everybody. Dr. Daryl Boston's here with Barrie Chiropractic and Health Services Center, and we're continuing our office reception area Ask the Doctor videos. So today I want to talk about, I'm in a comfortable spot here. We're in our little massage chair. I figured this would be an appropriate spot to talk about mattresses and a little bit about pillows too. So this is a question I get a lot. What type of mattress should I buy? And the answer to that question is, it depends on the person. There's a lot of good mattress companies, a lot of good mattress brands. Um, the ideal mattress for you is the mattress that's ideal for you, and the problem with that is that it might not be the ideal mattress for your spouse. So there's a couple of rules of thumb that you kind of need to keep in mind. The selection of your mattress really depends on the position that you sleep in, and there's three pure positions that you could be sleeping in. Of those three positions, two of them are okay, but one of them is the best way to sleep. So to understand that, I want to show you the plastic model of our spine. So this is a model of a person's spine facing that way from the side, okay? So I've induced these curves because this is the way that a natural spine should look. So the head would be sitting up here. This is the pelvis. So notice if you're facing that way, side profile, the neck should have a curve in it like this, the mid-back a curve in it like that, the lower back a curve in it just the same as in the neck, okay? If you sleep on your side, so I'm facing this guy now, remember that this model doesn't have the person's shoulders on it. So in my case, the distance between my head and my shoulders is however many inches that is. So if I'm sleeping on my side, the widest part of my body is my shoulders, which means there's a lot of pressure on my shoulders, which pushes my shoulders together, creates a lot of stress on the shoulder itself and rotator cuff muscles, which can cause a lot of trouble. It also can put a lot of stress on the rib joints where it meets the front of the chest, but most specifically, the rib joints where it meets the back. I see a lot of those types of cases where people have subluxated ribs in the back. A lot of times it's because they sleep on their side. Sometimes it's because of posture, but definitely sleeping on the side does not help. So side sleeping is one of the two positions that's okay. The problem is that it creates some ideal situations for the shoulder. If you're sleeping on your side, it's really, really important that you have a pillow that properly fits you here. So if I'm sleeping on my side, I need to have a pillow that fills the gap between my ear and the pillow so that my head's not doing this or getting pushed up away from if the pillow is too big. Far too often people will take a pillow and they'll scrunch it up and they'll shove it underneath here like this and they'll lay like that. And what they're doing is they create a fulcrum here, which shoves into the neck and creates the head to pull over this way, and it can create a lot of problems. I've had people in here with numbness and tingling because they start to compress that nerve. It's not ideal. So between shoulder problems, neck problems, and rib problems, sleeping on your side is not ideal. But if you are a side sleeper, make sure that you get a pillow that fits. So it keeps so if I was to sneak in your bedroom at night and check your nose alignment to the notch at the top of your sternum to your belly button, they should all be perfectly in line. You shouldn't be tilted off one way or the other. Further, if you look at a person, if they're standing, and I'm going to stand for you. You look at a person when they're standing, naturally we have space between our legs. So if you're sleeping on your side, you also need a pillow between your knees to keep your knees from doing that, which can stress out your lower back. Okay, so that said, mattresses. If you're a side sleeper, you need a more forgiving mattress, something that's a little bit softer. If you're a back sleeper, which is more ideal, you can afford to have something that's a little bit softer. So if this person is laying down, the purpose of the mattress is to allow this to sink into the mattress to a point where it can get supported, where the lower back can also be supported, and the pillow is supposed to fill in this gap of the neck. The pillow is not supposed to push your head forward, which pushes you up like that. It's supposed to support the neck and that natural curve that's supposed to be there. For back sleepers, you can afford something a little bit softer. Of all the people that have bought mattresses or have had trouble with their mattresses over the year, there's almost always one thing in common, and that is that they have a pillow top. I know it's really hard to buy a mattress today that does not have a pillow top in it, and they're actually a great selling feature because when you lay on a mattress in a showroom, they're pretty comfy cozy, right? You get kind of, you sink into it. Oh, it feels so good. But usually the top cover of a mattress is made up of a cheaper foam. Remember that mattresses are usually made out of some sort of supportive structure, springs, coils, whatever technology that they have. But the purpose of those coils is to push back and support you as you're sinking in. The mattress topper is usually made out of a foam. So you have to sink through all that foam before you reach those springs that give you support. And the problem with foam is that it breaks down really quick, like within 3 months in some cases. So that mattress that feels really nice in the showroom probably isn't giving you very much support if it's got a thick top cover on it, and it's probably going to break down fairly quickly because it's made out of a cheaper foam. And that is because because of what it's made of, and the lack of support is because you're not getting into those supportive coils. So my advice for mattress shoppers is always try to avoid the pillow tops wherever possible. I will say that memory foam is a little bit different. It's a lot more supportive. It's expensive. The prices of that is starting to come down now a little bit, but it's also pretty hot. It doesn't breathe as well as some other products, and it tends to be a little bit warmer. Latex mattresses are something that's kind of newer. There's a natural latex. It does not have a memory. It's really light. It breathes really well. I would encourage you to check out the latex mattresses, but if at all possible, try to stay away from the pillow tops. So to recap, it's best if you sleep on your back. And for those of you that are rolling your eyes at me right now saying, I can't do that, I sleep on my side, my belly, whatever the case may be, remember that we're all creatures of habit. I have this conversation with somebody at least once every 2 weeks. You can change your habits. If you're used to sleeping on your belly, you can get used to sleeping on your back. It's not going to happen overnight, but you got to start trying. Eventually, you'll get used to it. Your body's not going to let you not get enough sleep. So softer mattress if you're a side sleeper, firmer mattress if you're on your back. The best thing to do is to get in the showroom and lay on it for more than 15 minutes to see what's good. And some retail outlets are selling their mattresses with a 60-day return policy. I really like that type of policy because a lot of times it takes you 3 months at least to realize, I think I've purchased the wrong mattress. So if you've bought it from a credible place that has that take-back guarantee within those first 3 to 6 months, it's well worth it, even if there's a prorated cost, because they're an expensive investment. It costs you thousands in some cases to pay for these things, and they should last you, I think, 5 to 10 years. Usually when you get to around 7 years is when I'll start to notice people are starting to have trouble with their mattress, unless it's a cheaper quality mattress, in which case it might not last quite that long. So of all the brands that are out there, I don't think that one's necessarily better than the other for you. You have to shop around, get educated, listen to what the salespeople are telling you, compare notes from one brand or one shop to the next. Try to go to a retailer that has a take-back guarantee. Try to stay away from pillow tops. And one word on pillows. We have 2 pillows that I carry in the office, not because I'm trying to sell you a product, because of the purpose of it. This is an example of the water pillow. This pillow is the pillow that I've carried for, I think, 17 years now. The reason I carry the water pillow is because of its versatility. As you can see, it has a water bladder inside of it. The top part of it is nice and foamy, so you're not actually sleeping on water, but it's versatile. You can add or take away water, which gives it an increase or decrease height. I think I might have had one pillow in the last 17 years that leaked, and it was replaced without any problems. So if you're wondering about that, they're very well made. The problem with it, it's not meant for people that sleep in multiple positions. For those people that sleep on their back and their side, or are trying to transition from their side to their back, or just plain sleep on their side, I've got a pillow for if I can't beat them, join them. And that's this one. This is the Therapeutica pillow. You can kind of see the diagram of it here. The idea of this is that it's got a position for your head for if you're sleeping on your back. There's a ridge to support the neck, as I mentioned. There's supposed to be a natural curve there. And if you sleep on your side, it's a bit thicker. So looking at it from here, you see this little divot here, that's where your head would go. And of course, if you lay on your side, you need more space to take up, which is what this is for. And it's got one wing, if you will, on each side. It's made out of a foam that doesn't break down. That's another thing people will say. I'll ask people if they sleep on their side. They'll say, yes. How old is your pillow? Well, it's only a year or two old, and I really like it. It's always been great. But eventually, foam's going to break down. And once it starts to break down, it starts to shrink overnight, and that's what can lead to this. So you really need to be mindful of what's happening with your pillows. I'm going to say that if you get out 1 to 2 years on a pillow, it probably needs to be replaced. I know there's a big market in pillows over the last couple of years. Again, it really is a matter of preference. I only have these in the office because of their versatility. I hope that helps alleviate some of the questions that you might have. If you're shopping for pillows or mattresses, you really got to get out there and look around. And if you have any questions, please ask. The purpose of these videos is to stimulate conversation and questions. And please know that you really are appreciated. Thanks for being part of our practice. Until next time, talk then.